Hello Health on LAE is presented by the Ochsner Health System, a nonprofit, academic, multi-specialty healthcare delivery system dedicated to patient care, research, and education. The Ochsner Health System includes 7 hospitals and more than 35 health centers located throughout Southeast Louisiana. Ochsner, healthcare with peace of mind.
I call it my one less thing to worry about plan. With a Humana Medicare Advantage health plan, I get more clear information about my options with 24-hour access to my Humana, my secure website, and I can get help every step of the way from a Humana Market Point representative.
More of what you want, because you deserve more.
And good evening, I'm Tom Bagwell, and welcome to Hello Health, our partnership with the Ochsner Health System and Humana to bring Ochsner's Hello Health weekly education and information series to television. Tonight's guest is a very timely one. Earlier this month, we learned that for the first time in our country, there are more obese people than overweight people. Tonight, we're going to be discussing changing lives through weight loss surgery. Our guest is Dr. William Richardson, the Director of Laparoscopic Surgery at the Ochsner Health System and an expert in the area of bariatric surgery. Tonight's guest earned his medical degree from Harvard University and completed his internship, residency, and surgical research fellowship at Massachusetts General Hospital in Boston. Emory University in Atlanta is where he completed his fellowship in laparoscopic surgery. Dr. Richardson is board certified in surgery and has been part of the Ochsner team since 1997 and says he loves it in this city, and we're very glad that he does and has stayed. We are pleased to welcome Dr. William Richardson to Hello Health. Nice to have you on the program. You know, while perhaps even some of your colleagues chose to leave after Hurricane Katrina, you and many others decided to stay. Why was that?
New Orleans is a fascinating place. I think that New Orleans is a grabber for many people who can come and love the city. It's a city with great character. I think there are a lot of attractions here. But I'm also very lucky to be part of the Ochsner Clinic. And the Ochsner Clinic has a lot of very, very good doctors, and I'm very proud to be part of that service.
What is it about, you mentioned that you love this city, and it is an intriguing city, and you've lived in a very historic city in Boston. What is it about New Orleans that you and your family enjoy?
Well, it was my wife's birthday this last weekend, and there's nothing like going to a restaurant in New Orleans. So we went down to the French Quarter with some of our friends, and we had a very good time and just a delicious meal down there. There is a lot to love.
What was it, or who was it, that got you first interested in medicine? And I understand this answer goes back a ways.
Yes, I'm the 6th generation doctor in my family. We have 2 internal medicine doctors followed by 4 surgeons. So medicine does run in the family to some extent, and perhaps I'm genetically engineered to be a doctor to some extent. I was involved with it from an early age, and I know we're really trying to get children involved in being doctors at an early age and bringing them into the hospital and showing them around. And I was fortunate to have that experience early on, and I really enjoyed every minute of being in the hospital.
You said there was one surgery in particular that really caught your attention.
When I was very young, my father took me to Grand Rounds, and I watched a videotape of a child being operated on, and it was a very meticulous surgery, and it changed this child's life around. It made this child able to live a regular life afterwards. Being part of that is an incredible experience.
My research tells me there could be a 7th generation Richardson, another William. Will, who's studying at Country Day, has an interest perhaps.
Well, I don't want to push him into being a doctor, but he has expressed some interest in that. that, and he's very empathetic and very intelligent. If that's what he goes into, I think he'll be a very good doctor.
We wish him well in whatever he decides. Well, I referenced that survey earlier that revealed obesity is now a bigger issue in this country than just being overweight. What is today's definition of obesity, doctor, and overweight, and do the results of that study surprise you?
Being obese is being approximately 100 pounds overweight or more. It can be expressed in terms of body mass index, which is a way to relate height and weight. Somebody taller should obviously weigh more than somebody shorter. And to find out your body mass index, you can go onto our website or other websites on the net and find it out. So in terms of body mass index, that would be a body mass index over 30 as being obese. It is surprising that people are obese in that all around us we are told what foods to eat. There are places to work out just about at every corner. You'd think it would be easy for people to learn how to eat right and to exercise, but it actually is very difficult. And small things that we do in our lives are adding a few more calories or not maybe walking around as much as we did in the past, and we start slowly gaining weight, and it's very difficult to reverse that trend.
Well, some of our other physicians have talked about that at some point there's going to be a BlackBerry or some other PDA device that's going to allow you just to sit there and have everything happen for you when you just sit in the chair. And that's probably not a good trend, especially, it may be a convenience trend, certainly doesn't help us in the area of keeping healthy.
Well, think about walking to pick up your groceries. How many people do that? There's we have elevators where we go. We drive to work. We take the elevator up all the floors. And it's hard to find the stairs in many buildings. So it is a little bit hard to exercise and get around.
Of course, for everyone, we used to have to go up and change the channel on the television. Not that we want you to do that now, but of course now we just hold the thing, and men flip a little more than the women. I know.
There are a lot of minor changes, but I think there's a lot within us that tells us how big we're going to be. There's centers in our brains that tell us what weight we need to be, and it's very difficult for us to change that around. For a lot of families, it's genetically implanted in us how big to be. But our lives are very hectic, and I think it's hard for us to make good food choices when we're running around to get things that we have to get done now. To cook food at home every night means that you've got to have time to shop, to cook, and to clean up, and a lot of us don't have that extra time anymore. The cheapest foods also are some of the worst for us.
You said this country, there are other countries who have bucked the trend and gone the other way, where you were telling me that fruits and vegetables in some countries are cheaper than the easy choices for us, fast foods, and they see the results, right? Well,
that's very right. In Argentina, they sell the foods and especially the vegetables less expensively than many other things. So it's easier, particularly for the poorer people, to get only vegetables and things like that are good for them. Whereas in this country, it's fatty foods and things like that are easier to purchase. Cokes are very cheap. Things that we probably shouldn't be eating that are the easiest to get.
Partly, as you pointed out, because they're subsidized. Corn is subsidized by the government.
That's exactly right. Corn and corn products such as high fructose corn syrup are subsidized by the government.
We're in Louisiana, so we should also point out that so is sugarcane, subsidizes, so in all fairness. Are there causes of obesity, doctor, beyond overeating and poor eating that we should know about?
There are genetic reasons for us being obese. There are hormones within our body that tell us how much to eat and when to be hungry. Exercising, trying to get half an hour of an exercise in a day is very difficult. Especially if you have children at home, you come home from work, you've got to take care of the children. How are you going to go out and walk around and do something? So that those, obese certainly is taking in more calories than you use up in a day, but we actually have very little control over it.
Earlier you talked about the definition of obese, and just for clarification purposes, we all feel like we're a little overweight, or most of us. What is the legal, or not legal definition, but the medical definition of overweight?
Overweight is defined as a BMI over 25, and as I said, that's a height-weight calculation, and if you go on to any website that has the BMI calculator on, you can put in your own height in feet and inches and weight in pounds, and it will automatically calculate it out for you.
Okay, so if we go to the Ochsner.org site and search BMI,
yes.
Okay, we'll find that there. If we know overeating and poor eating habits lead to weight gain, why is the problem getting worse and not better?
Well, you'd think you could just tell people to change, but our bodies force us to eat these foods that are bad for us, and we have little control over it. Once people have gotten obese, it's a very hard trend to go back, because your body's mind sets your weight at that higher weight. And then if you try to lose weight, your body fights to get back to it again.
I'm guessing this is one of those surgeries, though, that you get excited about doing, because you are really changing people's lives, aren't you?
Well, it is amazing. You take somebody who can't get up and get around because they may be scared that they might walk somewhere and not be able to get back. They may be scared that they can't fit in a chair or a seat wherever they might go. They might be scared that the bathroom might not be able to hold them. And then they lose some weight, and they start to be able to exercise, and they start to be able to lose more weight, and they get their lives back again that they've totally lost.
You're looking right now at an example of, this is one of your patients?
This is one of my patients who had a gastric bypass.
There are a lot of people that appear to be healthy even though they're overweight. What are the problems associated, some of the problems associated with being overweight?
High blood pressure, which can lead to heart disease, and people who are overweight and obese who develop high blood pressure are going to develop heart disease early, diabetes, and then start ruining everything in their body with the sugar trouble, and high cholesterol are probably those are the three most major ones.
And actually, you brought a chart along of looking at obesity and mortality risk, because there certainly does ramp up your chances, doesn't it?
That's exactly right. This is a chart that relates people's BMI to the risk of death. So if we know that a normal BMI is between 20 and 25, and the risk of death we then say is 1, how does your risk of death go up as your BMI goes up? Well, as this chart shows, once your BMI gets between 35 and 40, your chance of dying is twice that of somebody who's normal weight. Of course, if you look at the other end of the spectrum, the BMI less than 20, those skinny people up there that a lot of people look up to are also not necessarily that healthy either. But so you want to try and remain as close as you can to the middle and an ideal body weight.
What are some of the lifestyle changes your patients experience after surgery?
Well, a lot of people have some arthritis, so that they get large. They either get arthritis and then can't exercise and start gaining weight, or they've gained weight and they get arthritis and they can no longer exercise, and it becomes a vicious cycle for them. Once we can get them losing some weight, and as soon as some of that pain from the arthritis starts to improve, they can start getting around. So they can start walking around their neighborhoods like they couldn't. They can start exercising, which they couldn't before, walking their dogs, going to the beach, walking up and down the beach. This woman here is now wearing her wedding rings. She loves the Saints. She's always been a huge Saint fan. She's now going to the games.
Good for her. And she's got a pretty good team to watch.
Oh, yes.
Dr. Richardson, talk to us about some of the diseases associated with, obviously, death is the final, but there are a lot of things that are going to take place in a person's body who is obese that perhaps we don't even think about with looking at obesity.
Well, I think you don't always know that people have diseases by looking at them. You'd have to look inside their medical cabinets or take a look at some of their blood work or so on, but they have coronary artery disease often, diabetes, high blood pressure. They're much more likely to get strokes, develop cancer, and sometimes they'll get depression, which can make their problems worse, or arthritis, which I said that can make their problems worse. Sleep apnea is where people have trouble sleeping. As they go to sleep, they start snoring, have a hard time staying asleep. They'll wake up several times at night. They might be sleepy during the day and have a hard time concentrating on their jobs, or potentially have a problem driving a car. And these people, we put little masks on at night to help them breathe at night, and after surgery they often get better from that. And then incontinence is trouble holding their urine. That's more embarrassing than anything else.
Are some of them surprised when you share with them, these are the factors you're facing unless you do something else?
The population that I deal with is very computer savvy. They're very intelligent people, and they've looked up on the computer. They know that this is killing them, and usually by the time they come to my office, most of them are saying, I want to live longer. Please help me.
Very interesting. What happens to the patients? You've shown us some of your patients and we see what they look like, but over the long haul, how are lives changed? In what ways? And how do they have to change their lives to remain looking the way you're showing us tonight?
Well, they do. You do have to realize that the surgeries are a crutch. They're not a cure. People do have to learn lifelong skills because there is a risk that they might regain their weight. So they have to learn lifelong skills of learning how to eat reasonably and exercising. So we try to get them to get the weight off, and we do try to see them every year after surgery to make sure that they're keeping up with good skills and try and push them along and doing everything just right so that they can keep their weight off. This woman here is somebody who's 5 years after surgery and obviously done very, very well in keeping the weight off.
Is counseling required for your patients so that it's more than just now you know you need to do a better job, but they're actually trained in the way that they need to cook for themselves or the way that they need to eat and to exercise?
Well, we do have a full team of people. Preoperatively, we get psychological screening for people, and we get them to see a nutritionist. We have a bariatric nutritionist, and then we follow them afterwards as needed with those kinds of things, but particularly with nutrition to try and enforce dietary behaviors. We also have a support group for people to come to, and they often swap recipes and sometimes clothes because as they've got their bigger clothes that they don't need anymore.
When is surgery the best option for a patient?
Well, at first they have to meet the criterion for surgery, which is a BMI greater than 40 or a BMI between 35 and 40 and another major medical problem. They have to have a documented attempt at weight loss, which almost everybody by the time they've come to see me has certainly tried, if not once, many, many times. Mm-hmm. There are two kinds of people. There are some people who've lost an extreme amount of weight only to gain it back, and other people who've really just not been able to make much of a budge in their weight. And then the next thing is that they absolutely have to be ready for a major lifestyle change. This is a life-changing thing. They're going to be doing things very differently than they have before, and they've got to be ready for that.
How do you measure that commitment level?
That's nearly impossible to measure, to know ahead of time what somebody's going to do afterwards. But we try as much as we can to focus on how extreme the changes are going to be and how committed they need to be.
When is surgery perhaps not a good option? And have you ever met anyone that you didn't buy the fact that though they may be telling you, yes, I'll be willing to change my lifestyle, you weren't convinced and maybe even talked them out of the surgery knowing it was even a greater risk to have it?
There are a few people, but not very many, we've wondered about. Most of those people have been people with major psychiatric illnesses or drug addictions where I was worried that they wouldn't be able to take care of themselves afterwards.
In some cases, these are life or death situations. If they don't make a drastic move in their lives, you showed us the chart earlier, their chances of survival over the long haul are not very good.
The sooner they make the change, the longer they are likely to live. Mm-hmm. We estimate, there have been estimates of people who are morbidly obese that we can increase their life maybe 8 years. Now sometimes we do operate on patients who are 70 years old who are in basically very good health, and we know we're not going to increase their length of life, but we should make their quality a lot better.
You brought a picture for us of a gastric bypass surgery. So as we look at that, go ahead and tell us exactly what's taking place in the operating room.
Well, gastric bypass surgery does two things. It restricts how much you can eat, and it makes it so you don't absorb everything you can eat. So if you look at this picture, we have the swallowing tube coming down to the stomach, which is the big thing in the middle there, and we've cut off the stomach near the very, very top, making a small stomach pouch. That makes it so that after you have just a couple of bites, you feel very, very full, less than the size of an egg for most people right after the surgery. We've then cut the small bowel and bring one end up to the stomach, and what that does is it separates out for a short period the food that comes down through the stomach from the digestive juices that come from the remnant stomach. Mm-hmm. Because they don't meet right away, the food is not absorbed, and this is called a gastric bypass.
Okay. How long would the surgery last, and what are the potential complications?
It usually takes me about an hour and a half to do the surgery, and there are a number of risks. The benefits do outweigh the risks, but there are a number of risks of leaking and pulmonary embolism and things like that. It is a major surgery.
What are the types of things you ask your patients to do ahead of time, pre-op, and then after surgery to minimize those risks?
The main thing is we do check on all of their health problems and optimize all of their health problems. And then we put them on a 2-week liquid diet immediately prior to surgery, which actually helps shrink the liver down, which sits over the stomach, and some of the fat that sits right around the stomach to make it easier for me to do the surgery.
Okay. What is the recovery time from that surgery, typically?
Gastric bypass surgery, most people stay in the hospital overnight, and generally they take 1 to 2 weeks off of work, but they do have to remain light duty for 6 weeks.
If someone walks in, and again, your definition is, I think, 100 pounds overweight, how soon would someone look like they look like in the photographs that you brought along to us tonight?
That takes at least a year with the gastric bypass. People do lose weight very, very quickly, but about a year to 2 years, people start looking like that.
Okay. Exactly how does the lap band work? And you, again, brought some pictures along to share with us.
Well, as I said, about the gastric bypass, that does 2 things. It restricts how much you can eat, and it also decreases the amount of food that you can actually absorb in your system. Mm-hmm. The laparoscopic band only restricts how much you can eat. In this procedure, we take a silicone, basically piece of plastic, and we wrap it around the very top part of the stomach. Inside that piece of plastic there's a balloon. The balloon goes to the tubing that goes to the port that sits underneath the skin on the belly wall. So we place that, and then starting 6 weeks after surgery, if people are hungry, we put a little bit of fluid into the port that sits underneath the skin in order to blow up the balloon, and we slowly blow up the balloon as they need it to restrict how much they can eat.
2 different types of surgeries. Compare the 2, and which surgery is right for which patients?
Mm-hmm. Well, that's a good question, and it's a difficult question. In general, we try to let patients pick their own, because with the gastric bypass, you basically set it, and then we just have the follow-up and encouragement with the diet and the exercise. Where the lap band, people actually have to come in and get adjusted, or they will remain unadjusted and it won't work for them. So they've got to be committed then to coming in for the adjustments. Also, because the lap band is primarily a restrictive procedure and people absorb their food normally, they have to be more ready to change their diets, because if they eat ice cream all day, chocolate all day, or things that are slippery and are going to go through the band, that's not going to be an effective way to lose weight. They just won't lose it.
I would imagine you get this question quite often. Doctor, if you were in my shoes, which surgery would you get? And how do you respond to that?
Well, it depends a lot on their other medical problems. With the gastric bypass, people will lose a little bit more weight on average, in my opinion anyway, and people will lose it faster, and it will get rid of diabetes and some of the other, particularly diabetes, but some of the other comorbidities just a little bit better. Mm-hmm. So if somebody has diabetes, I would push them more towards getting a bypass or multiple other medical problems. If they were otherwise healthy enough for the bypass, I would push them more in that way.
Very good. There is a nutritional change that has to take place after weight loss surgery. We've talked about some of that, but again, there's a diet progression that has to take place. Walk us through that, if you would.
It's 6 weeks worth of progression of diet. And we want to make sure that these surgeries sit exactly the way they are forever. And in order to do that, we need to slowly advance the diet so that as the healing occurs, everything sits the same way forever. So they're going to be on a sugar-free liquid diet, and then for a few days, and then we add protein shakes, and that's for the first 2 weeks after surgery. Then they're on a pureed diet for 2 weeks, and then a soft diet for 2 weeks. So at 6 weeks after surgery, they're starting to take regular diet. Now we do have to keep people crushing their medications for 6 months with the gastric bypass, and forever with the lap band. But we're trying to keep things from growing bigger
and it sounds like there's quite a bit of consultation that takes place. You're not on your own when it's over. This team is working with you to make sure that everything works.
My nutritionist goes over this very explicitly, and we actually hand out a book to our patients so that they can go back and look at it if they're wondering what they're supposed to do.
The final question, I'm going to skip one that I had here just for time purposes, but what are the advantages of laparoscopic surgery?
Laparoscopic surgery started in this country basically in the late 80s, and we knew from the beginning that there was a faster recovery, less pain with this surgery. With gastric bypass surgery, because there's not a large incision and because these people are so large, we also are decreasing the rate of infections and hernias with this surgery. To some extent, we get a better look at what we're doing because through one of the holes we use in laparoscopic surgery, we pass something called a laparoscope, and we actually see right next to what we're operating on.
Often doctors will use the term, and we hear it on this program often, gold standard. It sounds to me like both of these, neither one is a gold standard. They're both up there. Would that be fair to say?
They're both very good. They're both very good.
Okay.
I don't think one is not superior to the other. They both have their differences, and the patient has got to be dedicated whichever one they decide to have.
Well, we thank you for coming in, Dr. Richardson, and enlightening us in the area of weight loss surgery and how it can change lives. Thanks, and best of luck to you and everyone at Ochsner and your team.
Thank you, Tom.
You're very welcome. As we mentioned earlier, the Hello Health seminars take place almost every week across our area, and here's what's happening in February. On Tuesday, February 3rd, Dr. Jamie Bourgeois Huddleston, an Ochsner neurologist, will be at Ochsner St. Anne Medical Center in Raceland to discuss memory disorders. On Thursday, February 5th, ophthalmologist Poulin Shah will be at Ralph's on the Park to answer the question, is LASIK eye surgery for you? On Monday, February 9th, Dr. Michael Saucier will be right here with me to discuss stroke recovery. Should be a very interesting discussion. Tuesday, February 10th, Dr. Joe Jurisco, a specialist in the area of emergency medicine, will be at Ralph's on the Park to talk about emergency care in New Orleans, including the latest on Ochsner's new emergency facility at the Old Baptist facility. And Monday, February 16th, Dr. Nigel Geargraw, an Ochsner hepatologist, will be in our studio to bring us the latest about hepatitis C. Remember, Hello Health on LAE is now twice a month. To register for any of these seminars or to make an appointment with any Ochsner physician, including Dr. Richardson, who we've heard from tonight, you can call Ochsner at 866-624-7637. That's 866-624-7637. Our thanks to tonight's guest, Dr. William Richardson, to Ochsner and Humana for making this program possible. And our final thanks, as always, is to you for your support of this program, Hello Health, and our station, LAE. Television worth watching.
Hello Health on LAE has been presented by the Ochsner Health System. 600 physicians in 80 medical specialties working with a team of more than 10,000 employees to provide nationally recognized healthcare across Southeast Louisiana. Ochsner, healthcare with peace of mind.
We call it our More Money to Spoil Our Grandkids plan. With a Humana Medicare Advantage health plan, we get tips on how to make our money go further. We even get a health, finance, and benefits statement called Smart Summary that helps us find even more ways to save. And we like more.
More of what you want, because you deserve more.